Okay, so normally this is an in-class lecture, and it comes with an activity where you get a pre-test and a post-test, but we can't do it anymore. So instead, we're going to attempt this via lecture on the internet. I don't know what we're gonna do. But let's see how it goes. So first of all, we need to do an overview. What is sexuality, right? It's your sexual behavior, your desires, your fantasies. It describes your sexual orientation or identity. We have all these options: homosexual, heterosexual, bisexual, pansexual, asexual, and so many more, right? Really all I want to tell you is we have heteronormativity over here, which is the assumption that heterosexual is the only acceptable orientation. That's wrong. Everybody's orientation is acceptable, and your sexual orientation doesn't make you a human, and if your sexual orientation is different than heterosexual, it doesn't invalidate you. And you know, we just need to walk away from these things. You are yourself, and that's all that matters, right? Your sexual orientation is just a part of you. It's not what makes you you. And so we're going to talk about sex today, and if you happen to be someone who is asexual, aromantic, or anywhere in between any of these, just know the information for the exams, and for the rest of you, maybe internalize some of this stuff a little bit more rather than just for the exams. So we'll see what happens. But the first thing I want to talk about here is, and I have to move my face, is that we do a really bad job in the United States of educating people. Particularly adolescents, and adolescents are the ones really trying out the sex. So in these dark blue states, it's mandated. In the light blue states, it's not mandated. I want to point out the fact that in the dark blue states, just because it's mandated doesn't mean it needs to be medically accurate. So keep that in mind. And then some of the ones to point out are in Illinois, it's not mandated. However, health education needs to include medically accurate abstinence. I don't know what medically accurate abstinence is. So, yeah. And then down here in Mississippi, it's mandated, but topics are approved by the State Department. Have you taken a look at Mississippi State Department? I wouldn't look into it because it's pretty tragic when it comes to whether or not they know anything about sexual education. Over there in Utah, it's mandated, but it prohibits teachers from answering spontaneous questions. So I don't really know what you're supposed to do when it comes to those spontaneous questions, because Googling it is not a great answer. It really, in this moment, it's not a great answer. I know I tell you to do it often, but just not with this. You should have educators teaching you these things, right? And then last but not least, Tennessee's killing it. It's only mandated if the teen pregnancy rate is 19.5% or above. Good job, Tennessee. Okay. So let's take note of Alabama, mostly because this lecture are for my Birmingham Southern students, and we are in the city of Birmingham, and yeah, Alabama's kind of tragic. Parents can opt out of whatever education is offered, but remember, it's not mandated. When provided, sex education must be age appropriate. What? What is age appropriate? I don't know. Include information on contraception, stress abstinence, importance of sex only within marriage. Be sure to wait, even though I know that, you know, most of you aren't, so this is why you're listening to me instead. Negative outcomes for teen sex need to be included. And then this is the big kicker for Alabama. This is what makes Alabama win everything, is that if it's mentioned, homosexuality must be referred to as a sin. So yeah, that's great. The only life skill you need to include is avoiding coercion, not how to coerce, but avoiding coercion. HIV education is mandated, but it needs to include condoms, but stress that whole abstinence thing. It doesn't work. Abstinence doesn't work. It does not need to be medically accurate. It can promote a religion. It can be culturally inappropriate and biased. Look at that homosexuality thing again. And it's allowed to miss things like life skills of healthy decision-making and family communication. When I teach this, often I hear about this woman that goes around to the Birmingham area and that is, first of all, if it is taught, it's usually segregated by gender, and so the girls go in one room and the boys go in another room. And this woman who goes and speaks to the girls balls up a thing of masking tape, sticks it to herself and passes it to the next girl, and then they pass it all the way around until the sticky ball gets back to her, and she goes, "What's wrong with this tape?" And then people go, "It's covered in lint and it's lost its stickiness." And she goes, "And you will be too if you have sex before marriage." What the fuck? That's not sexual education, right? But it is for a lot of schools down here in Birmingham. SB 140 was a bill that one of the Republican senators down in Mobile tried to pass, and of course it didn't go anywhere, where he tried to make everything medically accurate and kind of remove that homosexuality as a sin thing. So we're trying, but of course it didn't go anywhere. And he's going to try again from what I think I was told a while ago. So let's keep moving. So, the male and the female reproductive system. If any of this is new information to you, what I suggest you do is stop this video, go get a mirror, and explore. When you're done exploring, you can come back. I'm not going to test you on any of these things. It's just something for you to know. The one thing that I do need you to know, though, is that everyone's genitals are made of the same parts, organized in different ways. No two are alike. Unless you are experiencing pain, and if you are, speak to your doctor, your genitals are normal and healthy and beautiful and perfect just the way they are. This comes from a wonderful book called Come As You Are. If you would like to read it, the citation is down there. Okay, so there's no such thing as safe sex, which is why we have so many abstinence-only programs. I don't understand, because I think they think that, like, maybe the kids don't need to know about sex, and quite honestly, the kids are doing the sex, so they need to know about the thing. But there is such a thing as safer sex, and that's protecting yourself and your partners against STIs, right? So you can do things like use a barrier method, get tested regularly, outer course, and avoid drinking and drugs. And so using a barrier method is often the easiest one we can come up with is a condom. And this is usually when I go down a condom demonstration with my students and ask them what the first step is, and more often than not, they go, "Open it." And I'm like, "No, you need to check that expiration date." Because condoms expire, and if you've been keeping it in your wallet, throw it the fuck away anyway, because it's not useful to you. Do not put condoms in dumb places. Like, read the back of the box. It tells you what to do with them. Getting tested regularly. This is when I ask for all my student athletes and people in fraternities and sororities to be the ones at the front of the line whenever we have free testing on campus. Because if you lower the stigma, everybody else is going to lower the stigma. And then people will get tested and we will be a healthier community. Outer course is everything that's not intercourse, so you can have fun with what that means. Planned Parenthood is a great website for you to learn what all the different outer course options are. We would have a example of those things in the real class, but we can't, so I need you to go to Planned Parenthood's website on your own. And then finally, avoid drinking and drugs, because especially when it comes to alcohol, we stop losing our ability to make decisions. And we forget things like using a barrier method when drugs and alcohol are involved. So avoid doing those when you're practicing safer sex. Okay, so HIV and AIDS. There's still a big stigma associated with HIV and AIDS, and this is my attempt at lowering that stigma. So, HIV, human immunodeficiency virus. It causes a spectrum of conditions and symptoms. It's most linked with AIDS, the acquired immunodeficiency syndrome. There are 5 fluids that transmit HIV. Those fluids are blood, semen, vaginal fluids, anal fluids, and breast milk, right? Those are the 5 fluids. I don't want to hear nothing on these exams about tears and spit and saliva. No. Those are the 5 fluids. Those are the only 5 fluids. There's something that I want to point out when this virus first sort of showed up. Medical facilities started using the 4 H's of HIV and AIDS as a way to try and figure out if the patients they were seeing happened to be at high risk. And those 4 H's were Haitians, heroin users, homosexuals, and hemophiliacs. And then there might have been a bumper sticker at some point in time, or a pamphlet that said, you know, HIV killing all the right people, and included those 4 categories. And so, you know, people were real shitty, and so we're trying not to be anymore. So this is my attempt at that. And then the last thing I want you to know is nothing transmits AIDS. AIDS is acquired from HIV. So those 5 fluids don't transmit AIDS, they transmit HIV. South Park ruined a bunch of people with the whole idea of full-blown AIDS, and you can get HIV, and AIDS is acquired immunodeficiency syndrome from HIV, right? And so I need you to know the difference between the two. I'm going to give you a quick little rundown of these. You can look at these on your own. Major things are like we had an epidemic in Haiti, a new disease found drug users, and then we got GRID, which is gay-related immunodeficiency disorder, and then people with hemophilia. In 1985, it took until 1985, right? We had these things happening in the early 80s in the United States. But in 1985, Reagan finally mentioned AIDS and mentioned it incorrectly. Does that look similar to what's happening with this current virus that we're dealing with right now? It does. The parallels are just too close. They're too close. And then we ended up with in 1991, we got the Red Ribbon campaign. Magic Johnson came out and said that he had it. Freddie Mercury died. It became the top killer of Americans aged 25 to 44 in 95. This is when we lost Eazy-E. In 1998, Clinton refused to fund the needle exchange program that started in 1986, so he fucked that up for us. But then Bush, in 2003, this is George W. Bush, not H.W. Bush, his dad, announced a $15 billion plan to combat the crisis internationally, and so that was really awesome. We got an HIV outbreak in the porn industry, and then in 2012, PrEP was approved. Look up PrEP. Figure out what it is. This is your homework for this lecture. So, contraception, we get into ancient Mesopotamia and Egypt. We had some crazy ways in which to prevent pregnancy since the beginning of time. So, we had lint and leaves and honey, and you just shove that up in there and hope for the best. There was also the crocodile dung that you would also just shove right up in there and hope for the best. In ancient Greece and Rome, this one's one of my favorites. Think about how many people were on the planet during this time. This plant, we thought, the Syphilum, I don't do Latin, so it's fine, was used as an oral contraceptive pill, but it wasn't really a pill, you know, they just used it. But people used it so much that the species went extinct during ancient Greek and Roman times. And then the Bible, the book of Genesis, includes the term coitus interruptus, which is the pull-out method. And so whenever somebody tells you that the Bible is anti-birth control, you can point them to that. And then Aristotle said cedar oil would work. It doesn't. It doesn't work. But let's look at the things that do work. We got condoms, diaphragm, spermicidal jelly. We get the IUD, female condoms, the OCP, the emergent oral contraceptive pill, and the ECP, which is the emergency contraceptive pill. And then we got the shot, and we get the ring, and we get the implant. We have all these things. This link down here, I do want you to click. It is Sexual Education in Mississippi. Mississippi is not allowed to do condom demonstrations, and so they get a little creative with how to teach you how to do that. One thing I want to point out over here in this moment specifically is that if you're using lambskin condoms, it is only protecting you against pregnancy. It is not protecting you against STIs, so keep that in mind. Okay. These are all the different options for contraceptives, and remember, contraceptives are not protecting you against STIs. They're really only protecting you against pregnancy. These are the effectivenesses of all of these options, so just look at them. And then finally, consent should be freely given, reversible, informed, enthusiastic, and specific. If it is not a hell yes, it is a hell no. I do not understand why, for some reason, we keep teaching people that talking to your partner ruins the mood and it doesn't make sex fun. It makes sex even more enjoyable if you can talk to your partner. If sex is something you want to do, you should be paying attention to your partner. We need to teach consent, and we need to understand that it's not just consent, but it is also how to protect yourself from STIs and how to prevent pregnancy, and that your parts are beautiful and nothing is wrong with you. And we have too much media that tells us the opposite of this. And so this is me telling you, if sex is something you enjoy, you should do it, but you should do it in the safe ways, with consent, with barrier methods, without drug or alcohol, you know, in ways in which you protect yourself and you protect your partner. And we need to lower the stigmas around sex, because we're all, you know, a vast majority of us are having it, and a vast majority of us do not know the ways in which to have it in great ways. And you should enjoy it, and so should your partner. And so this was my little lecture on sex. I would have given you so much more in the classroom, and I wish we were still in the classroom, but we're not. So this is what you get, and I hope you learned something. And, you know, go out, have fun, but do it safely.